I'm Dr. Michael Kay from the Center for Functional Health, and I'm very lucky to be sitting here with Bruce today. Bruce has been going through one of our programs, and Bruce, thank you very much for doing this, and I am just amazed. So you went from 262 pounds to 187 pounds
To
over this last 6 months.
272.
272 down to 187 over the last 6 months. So that's absolutely fantastic. So a little bit about your journey. So you've come to, I think, like 2 or 3 of our talks. That was like last year and some of the year before. And we've been communicating back and forth, and lifestyle has been changed and all that. And we're lucky that we have Kathy. Kathy's a friend of ours who has been helping Bruce be accountable as well. So can you share a little bit in the beginning? Remember when we first saw each other, how like your stomach was really bloated and you had a lot of pain and discomfort?
I suffer from bloating, 6 or 10 hour bouts, depending on what I eat. And I had a test done here at the office. Well, bacterial functional gut.
Right. We did the GI MAT
Yeah.
test, which showed the bacterial overgrowth, which your doctors did not do the GI MAT test.
No, I had to ask, and it was at the VA, and they did do a breath analyzer test.
Right.
And it came back and confirmed that what Dr. K said. And I went through a course of antibiotics, and also I was taking supplements, probiotics, and enzymes from Dr. K
Right.
recommended.
We got those.
And over a course of time, my gut got a lot better. I felt better, and as of now, I haven't had any problems. Knock on wood.
Right.
I attribute that mostly to my bad habits I had, eating junk food. I was eating cheesesteaks, hamburgers, pizza,
Wawa runs. We're going to Wawa.
ice cream, Chinese buffet.
Yeah, Chinese buffet.
And I actually destroyed my gut and got bacteria. And now I'm eating very healthy, eating 3 times a day with maybe a couple snacks in there, and feel great.
So let's talk about diet change, because I know when we talk to patients about lifestyle and diet change, it's like pushing a boulder up a hill, right? It's hard for a lot of folks.
Oh, yes.
So I also say, let's not wait for a diagnosis to change your life. So sometimes you can't. So we know that the blood sugars were going up. We know that the liver was a problem, the gallbladder was a problem, there was bacterial overgrowth. All this was present. So we talked about before, we got to change the diet, we got to change the diet, but there was some pushback. So what was the time that you finally said, okay, you know what, I got to stop? Is it pain that made you finally said, I need to eat something different? Is it like, I'm tired of the way I look? Energy? What was it that you finally said, hands up, I give up, I got to do something different?
Well, actually, it was all the above. Get tired looking at myself, looking like crap. The way I felt. Also, some health scares. Unfortunately, you all say you're responsible for your actions, whatever.
That's right.
And I started, getting diabetic problems, cholesterol problems, liver problems.
Yeah, triglycerides that were a problem, liver enzymes that were a problem.
That's the big thing. I mean,
Yeah.
people don't realize, people think, oh, you have to drink yourself to death to get liver problems, but you don't. The cheesesteaks, pies, cakes,
Yep.
you name it, all that stuff attributes to your fatty liver problems.
Right.
And you can reverse that by a healthy diet. And I got to the point where I just said to myself, well, I want to keep living for a little while here,
Sure.
longer. And right now, like I said, I feel great, and I think I'm in the right direction.
Oh my God, for sure. So, I mean, you're leaning towards what we call non-alcoholic fatty liver disease, NAFLD is what you were leaning towards. By changing your lifestyle, you pretty much have drawn that back, which is absolutely wonderful. So, when speaking with patients, the problem that they have often is they have these cravings. So I know when you went through this, we talked about just before the cravings. How did you tackle those cravings? Because patients are like, I want this, whatever this is, I need it, I want it. So how did you get through those cravings? I know you were making Wawa runs, and there was cheesesteaks and the ice creams and all that kind of stuff.
Well, it's very hard, but I guess with me, I got to the point where I said, well, you know, I just can't keep doing this, and plus the health problems, they're that's a motivator. In dealing with cravings, right now, I might have one day of the week I'll have like something I crave.
Right.
Like if you crave pizza, you know, have one or two slices, but you know, don't load down grease and all that, and you can
Right.
put some healthy toppings on it. Or this last Friday I went to the Hickory Stick and I had got a medium non-dairy cone. And if you say, well, okay, and my next day is going to be next Friday, or I have something, it did the trick for me.
Mm-hmm.
And your body can absorb that once a week, I think.
Okay.
You know, one meal a day or a snack.
Did you feel eating that one meal though drove you like I need to have more, or were you able to say, okay, I had my allotment and now I can move on?
Basically, I can move on.
Okay.
Well, there is a little bit of self-discipline, but I found what I'm eating satisfies me. I know during the worst part of this pandemic thing, you know, people were going out, me also, just grab and go.
Right.
I really couldn't scrutinize what I was buying.
Mm-hmm.
Uh,
I mean, there was a panic. So, I mean,
Right.
you know, obviously we're wearing masks because we're still in this COVID-19 pandemic. So I know a lot of people were really struggling at home. And, you know, they call it COVID-19. And a lot of people were getting 19 pounds, 20, 25 pounds staying in this quarantine. How did you handle it? I know in the beginning it was like you're just grabbing stuff because I think everybody was grabbing, not knowing what's going to be on the shelves. But then you got to a point where it's like, okay, I can't eat this. So how did you handle being quarantined and still eating healthy? Were you still active, getting out, doing walks and stuff like that?
Yeah, I was walking every day, maybe twice a day, and I went to the supermarket. And I'd go in, and the first section you're in is a produce section, and for some reason there weren't that many people in the fresh produce section. So I'd go in there and grab a whole bunch of stuff for my salads and stuff. I'd go maybe get unfortunately some canned vegetables, low sodium. Then I'd try and hit the frozen food case and get some frozen vegetables, they're there, and around the outer perimeter and grab some eggs, and that was it. Then as time went by, you know, people weren't panicking that much,
Mm-hmm.
as much as they were. I was able to go in there and, you know, maybe look over what I was buying,
Right.
and consuming. But now, you know, it's no problem.
So a typical day of food for you now would consist of what? What would be like your normal breakfast?
Okay, normal breakfast right now, I have rolled oats with blueberries and almonds in the morning, and I have some egg whites and an egg yolk. Put a little mushrooms or some onions
Mhm.
mixed in with that,
Sure.
make like a small omelet. And when I'm done that, I'm pretty full. For lunch, right now, usually I have a big bowl salad with either good turkey or tuna fish, olives.
Mhm.
I love olives. Some olive oil, mayonnaise, because I feel like, you know, a little bit of that good fat
Mm-hmm.
Keeps
Good
me-
fats are great.
keeps me more satisfied. And I
Sure.
also put a little small baked potato in there. For me personally, I find I need, you know, a certain amount of carbs.
Yeah, like a carb pick-me-up.
Right. Then for a snack, I might have half a banana or maybe a whole banana, depending on if I'm walking,
Mhm.
exercising hard. Some berries or some strawberries. And for dinner, I'll have fish, chicken, or turkey.
Mm-hmm.
Once in a while, I'll have some beef, some good beef, and I'll have, vegetables, big salad, and for a snack, I'll have maybe some berries, some strawberries again,
Okay.
so a banana maybe before I go to bed, because I find bananas kind of are easy to buy, cheap,
Right.
and they're decent for you.
And so for the most part, you do feel satisfied.
Yeah, I do. I mean,
Okay.
that's the biggest thing right now. I don't feel like I'm starved. I feel like I'm satisfied. Uh,
Do you feel your relationship with food has changed?
yes, yes.
Okay, because a lot of times people feel, well, it's breakfast, so I gotta have breakfast. It's lunchtime, so I gotta have lunchtime. It's dinner, I gotta have, it's dinner. And, they eat more so because it's time to eat than I'm hungry or I wouldn't be satisfied. So do you find that like now you when you stay on your schedule, you are full, you are satiated, and mentally you feel okay?
Yeah, I think personally I like to stay on a schedule. It keeps my energy levels up. I know some people just kind of more eat like when they're hungry, but
Sure.
personally I like to keep to a schedule. I find if I don't eat a little bit of healthy snacks before I go to bed, sometimes I'll lay there in bed and I get like a gnawing stomach.
Right.
And
Right.
it just keeps you up.
Right.
So you're better off eating something good.
Right. We I remember talking about that before. Okay, fantastic. So my question to you is, we have people that come to the presentations or they'll follow us on Facebook. What would you say to somebody who's sitting on the fence? I don't know if I should work with Dr. K, the Center for Functional Health. What would you say to them? Say, go, not go. What's the difference?
Well, I would say having Dr. K is a good complementary thing to do with your regular primary care, because I find your primary care doctors, even some specialists, really don't know too much about nutrition, about diet, and also Dr. K can look at your medications and your food or your medications and your supplements that you want to take, and
Right.
he can tell you, are they safe to take together?
Right. Because sometimes they contradict each
Yeah.
other.
Like I was looking into an immune booster, and Dr. K looked it
Right.
over and said, okay, with your medication, I take like 5 medications, which I'm trying to wean myself off of.
Yeah, they'll start
Yeah.
coming down. With the
Yeah.
more weight loss and the things that are coming up. So.
And also, if you have a problem, if you have like a sore shoulder or a sore knee or
Right, we
stiff
get the
neck.
musculoskeletal.
a question with working out, you got Dr. K. And that's the
That's
biggest
good.
benefit, I
Thank you.
think. I
Yeah.
think you should have a functional medicine doctor and
And a primary care
a
doctor.
primary care.
Yeah.
Because, you need a primary care,
Sure.
even though they give you 12 minutes.
Right, but
Okay.
that's okay. That's where we fill in the
Yeah.
gap, right? So a lot of docs sometimes are like, okay, well, don't see that doc, don't see that, but we build that team, and that team's important. So we keep everybody abreast of the situation. So I think as a team approach, the patient's health can really excel.
Mhm.
So I think it's really important. So again, congratulations. Thank you for doing this. I really appreciate it. I know it'll definitely help some others. What a fantastic job. Congratulations. You are much healthier now than you were 6 months ago, especially a year ago. So health is everything, especially now. So I really appreciate it. Thank you.
No problem.
All right.